You finally did it. You received a PRP or platelet rich plasma injection, and you may be wondering, what do you do now? In this video, I'm going to break down my post-procedure instructions. For those who don't know me, my name is Dr. Sonam, and I am an interventional sport medicine doctor practicing in Canada. Today, I'm going to share with you some of my post-procedure instructions I provide my patients with after I perform a PRP injection. Now, if you like the content of this video, please leave something down below, emoji, happy face, comment, just for the engagement part of things. Not something I'm used to doing as a doctor, but I think YouTube likes it. So let's keep on going from here. For those of you who don't know what PRP is, PRP stands for Platelet Rich Plasma, and it is a newer form of a regenerative, natural type of therapy that we use to treat a multitude of conditions. It is made from your own blood, so I take your blood, I spin it down, and I inject it back into certain areas of the body, and we use it to treat osteoarthritis, tendon problems, and a billion other more things. I'll leave a list right here. The first thing you'll likely encounter is there is no standardized post-procedure injection protocol. So much so that I actually made one for my patients, and for everyone I do, I give them a handout on what to do both before and after the injection. If you're interested on how to be prepared for the injection, check the video we're going to link up below. And it is very important to always follow the instructions of your provider because things change from patient to patient. Number 1, what can you take for pain after the injection? So it's not uncommon to have an increased amount of pain after the injection, and I actually heavily counsel my patients on this. For PRP injections into joints, people tend to do quite well, and Tylenol seems to suffice things. Pain lasts about 1 week max. For tendons, however, pain can be worse for a period of 1 to 2 weeks because we actually cause little micro trauma to the tendon and have put the PRP in the tendon itself. So it's not uncommon to need stronger pain medications, and I'll frequently provide my patients with a prescription for this after the procedure to take for a period of 5 to 7 days. Now, it is important with all of these procedures, no anti-inflammatories. Aspirin, Advil, naproxen, you name it essentially. Do not take anti-inflammatories for the first 1, maybe 2 weeks after the injection, as it will basically do the opposite effect of PRP. So PRP, we want to stimulate a inflammatory reaction, and an anti-inflammatory will cancel that out. So be sure to listen to your provider and do not take anti-inflammatories for the first 1 to 2 weeks after the injection. Number 2, ice and heat. Heat, avoid. Do not take it. It tends to make things worse, swelling worse, pain worse. With ice, even though I want to kind of have an inflammatory reaction for the PRP to work, you can use a bit of ice in the first few days to help mitigate pain and swelling. Number 3, pools, saunas, hot tubs, lakes. So it's very important to avoid any form of dirty, still water for a period of 24 hours after the injection because we created a hole in your skin and we don't want to risk or introduce any potential risk of an infection. With respect to anything hot, so hot tubs or saunas, I would avoid them for up to 1 week after the injection because you don't want to create any more pain and swelling to the area, and sometimes they can kind of aggravate an area after the PRP procedure. Number 4, rest and activity. So this is a big one, and it differs depending on what area we injected. So I'm going to split this up, joint and tendon. So if we inject an area like the joint, I usually say rest for a period of 48 hours because it's going to be irritated, pain, and stiff. The reason why it can also be a little bit more painful is we cannot use freezing with these injections because freezing theoretically inactivates and irritates the PRP molecules we're trying to put into the joint. So these have to be done without freezing. So it's not uncommon to feel sore and achy kind of after you leave my procedure room. Usually in the first week, I say take it easy, gentle range of motion, gentle walking, and then I get you to increase the activity and increase some of your strengthening exercises week 2 and 3. It's not uncommon to feel quite good by week 3, week 4, specifically for joint-specific injections. Now, this can vary patient to patient. These are just general guidelines. For tendon specifically, so this is one I counsel pretty heavily on because it does induce a lot more pain because we cause some micro trauma to the tendon. So it's important to rest for the period of kind of the first week and avoid any forms of strenuous physical activity. So for example, in the case of a shoulder, I'm saying no heavy lifting, very gentle range of motion, get some blood flow moving in there for the first week. Week 2, work on a little bit more strengthening. Week 3, push the strengthening a bit more. Week 4, start to get back to some of your normal activities. And it can take anywhere from 6 to 8 weeks to get back to kind of pre-procedure levels, specifically in the realm of a tendon. Now, when you're rehabbing tendons, it is actually very important to work on eccentric loading of the tendon. So what does that mean? Have you ever done a dumbbell curl up? So this is your concentric. Eccentric is when you lower it under load. The reason why that's so important is it actually stimulates formation of new tenocytes, stem cell formation. It's kind of one of the ways we treat a lot of tendon problems. Now with both of these, I heavily encourage people to see a physiotherapist after the procedure to really help guide their therapy. Number 5, monitor for signs of infection. So this is a very important thing I counsel all my patients on, no matter what type of injection I do for them. It is important to monitor for signs and symptoms of an infection, which include fever, increased pain, increased swelling, and increased redness at the site. Now, usually infections present themselves 5 to 7 days after the injection because it takes that long for the bacteria to grow. If this happens, please contact your provider as soon as you can. Number 6, when will my PRP injection work? So this is a very important thing I counsel patients on, mainly for expectations. Usually, it can take up to 8 to 12 weeks to see the full benefit of PRP, and this differs whether or not we did a joint versus a tendon. I find joints tend to settle down a bit quicker than tendons, and tendons may need the full 8 to 12 weeks to see that benefit. Number 7, do I need more than one injection? So if you've done any literature deep dive into PRP, you're going to see that there are multiple protocols. And essentially, sometimes for a joint, there are some protocols that say you need one injection for 3 weeks, and then we reassess symptoms. Whereas for a tendon, they'll say you need 1 or 2 injections. The way I treat is I really allow the patient response to guide my next steps, and this will differ provider to provider. So what I do typically for joints is we do the 1 injection, reassess symptoms, and if another injection is needed, we can consider it at that time. Usually for joints, if PRP is effective, it lasts for approximately 1 year, and you're looking at yearly injections of PRP for the joint. Now, in the realm of a tendon, 1 injection is very well a possibility to actually cure the issue. So in a lot of cases of tennis elbow, for example, I'll do a PRP on the actual tennis elbow, and 1 treatment is all my patients need. Sometimes people will need a second treatment, but usually I find in the case of some tendon issues, PRP can be curative. Not in everybody, but in the vast majority of my patient population, I'm getting some really good responses. PRP is a revolutionary treatment in the sport medicine industry and is being used at increasing higher and higher levels. I find that patients are gravitating more towards natural regenerative type therapies and therapies that can also help address underlying causes to issues. For example, fixing the actual irritated tendon in a tennis elbow. Now, it is very important to follow all the post-procedure instructions by your provider, and what I've provided is mainly a guideline of what to consider after you get the procedure. If you want to learn more about PRP, I'm going to leave some resources down in the description. If you have any questions, leave them in the comments and I'll do my best to get to them. If you like this video and want to see more videos like this, please like and subscribe to my channel. For now, that's all.